Hello everyone, welcome to our symposium on diabetes. I'm Dr. Zha. Today we have invited Mao Yin as a guest to participate in this symposium. Hello, Mao Yin.
Hello, Dr. Cha. My name is Mao Ying. I'm very happy to invite to participate in this sub-M.
Before we begin, Mao Yin, I would like to ask if you will control your diet and plan your lifestyle reasonably.
I usually pay more attention to the reasonable diet country and lifestyle, the planning. I will try to ensure a balanced diet. Eat some the fruit and vegetable and reduce the intake of the high calorie, high fat and the high sugar food in terms of lifestyle. I also the mention of a moderate amount of exercise, have a regular schedule, and avoid staying up late.
Yes, a healthy diet and lifestyle can be very effective in avoiding many diseases. So, Mao Yin, I have a question for you. Do you know anything about diabetes?
Yes, I have a little understanding. I read a book about diabetes, which said that diabetes is a diabetes egg when the parents do not price enough the insulin, where the body cannot effectively use the insulin. Is the product insulin is a hormone that regulates blood sugar. Hypoglycemia or elevated blood sugar is a common consequence of out-of-the-country diabetes. Over the time, it can cause the serious damage of the many systems of the human body, accelerated level and the blood vessel. I was the search for the private information online. In the 2020, 8.5% of those over the age of the 8 have the diabetes. In the 2019, diabetes was a direct cause of the 1.5 million. There's the 48% of the diabetes deaths occurring before the age of the 80, or so the 4,600 calories. Direct deaths was the calories by diabetes, which is the cause of the elevated blood sugar, about 20% of the cardiovascular deaths. This.
Yes, you are right. In order to give you a more intuitive understanding of what diabetes is, let's take a look at the following video.
Diabetes is a disease in which glucose, or sugar levels, are above normal in the blood. Most of the food we eat is turned into glucose that our bodies use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin that helps glucose get into the cells of our bodies. When you have diabetes, your body doesn't make enough insulin, or it can't use its own insulin as well as it should. This causes glucose to build up in your blood. There are several types of diabetes. In type 1 diabetes, the body does not make insulin. In type 2 diabetes, the body does not use insulin well and may not make enough insulin. This is the most common form of diabetes. Gestational diabetes happens when a woman's body does not use insulin well while she is pregnant. It raises her risk for type 2 diabetes and raises her child's risk of getting diabetes. Diabetes is serious. Over time, high blood glucose levels may cause many health problems, including heart disease, blindness, kidney failure, and foot sores and amputations.
After watching the video, I believe you have a deeper understanding of diabetes. In fact, I also conducted a small before this symposium. We can see these four pictures. It is found that most people have a good lifestyle, but when it comes to the understanding of diabetes, there are many deficiencies in people's cognition. So, Moyin, do you know what are the causes of diabetes?
I generally know that if you have the diabetes in your family, special immediate relative, your risk of development diabetes will be significant increase if you have unhealthy eating habits. The risk of the development diabetes will also increase. Include the eating high sugar, high fat, and high-calorie food, except refined carbohydrate and sugar drink, except abdominal obesities, are one of the main causes of the type 2 diabetes. Exercise fat carriers can lead of insulin resistance. A sedentary lifestyle can lead of the weight gain and the insulin resistance, which increase the risk of the diabetes. The risk of the type 2 diabetes increase with the age exactly after age 45.
Yes, the causes of diabetes can be summarized into six module points. In addition to the aspects mentioned in Moi's answer just now, diabetes is also caused by psychology factors, and long-term psychology may affect blood sugar levels. Pregnancy factors due to abnormal homocysteine can lead to diabetes. Looking at the output, Moyin is fully prepared for this symposium. Moyin, do you know what are the effects of diabetes? Looking at the output, Maoyin is fully prepared for the symposium. Maoyin, do you know what are the effects of diabetes?
Treatment and management of the diabetes require the long-term medical investment, and the cost of the medical equipment such as the blood glucose monitors and the regular checkup can place a heavy financial burdens on the individual or the family. People with the diabetes and different keep the blood sugar levels stable, which can lead to the high blood sugar, hypoglycemia, or the low blood sugar. Long terms the high blood sugar and drum the body organs. Diabetes has a genetics, predisposition, and effective the parent may pass the risk of the diabetes of their children, which increase the risks of the intergenerational combination of this of the family level. As the prevalence of the diabetes increase, the burdens on the social media result increase. The pressure on the public health system also increase.
Yes, there are three main categories of diabetes harm. One, long-term complication. It has four situations: cardiovascular disease, kidney disease, neuropathy, eyes problems. Two, short-term complication, hypoglycemia. Patients who take insulin or certain oral hypoglycemic drugs may experience a hypoglycemic reaction that causes dizziness, sweating, palpitation, and even syncope. Diabetic ketoacidosis, especially in patients with type 1 diabetes. When the body does not have enough insulin, the breakdown of body fat accelerates, producing a long number of ketones, resulting resulting in acidosis. Three, psychological and social impact. People with diabetes need to monitor their blood sugar regularly, control their diet, and may need to take medications which can be inconvenient and stressful in daily life. Mental health problems. People with diabetes may face mental health issues such as anxiety and depression that affect their quality of life. So the last question: how would you prevent diabetes, Mao Yin?
I usually eat the whole grains, include the brown rice, oats, whole wheat, brown quinoa, and the median, which are the rice in the dietary fiber in vitamin and the minerals, coupling with the refined grains such as the white rice and white brown. Ground grain and the dairy is the more slow and well not the carbs. A repair rice in blood sugar. Have to mention blood sugar, stable, vegetable, and fried are rice in the vitamins, minerals, and antioxidants that help to improve the immunity, the reduce inflammation. At the same time, the head fiber to contract those the food can help to contract the blood, the sugar, and reduce the risk of the cardiovascular decrease ingesting. Promotions such the fish, egg, beans, etc. before the eat the carbohydrate have future slowed down the rise of the blood sugar and the promotion of the stable of the blood sugar after the meals. In addition to the dedication exercise time, increasing the amount of the dared attractive such as the climbing stairs and the working and housework. can also help to bear calories, to contract the weight, and prevent the occurrence of the diabetes.
While learning about diabetes prevention, diabetes also have a lot to look out for. Dietary control. Eat wisely. Choose foods that are low in sugar and low in fiber, such as whole grain, vegetables, and fruits. Control carbohydrate intake. Avoid excessive intake of simple sugars and refined carbohydrate and eat meals separate and regularly. Monitor blood sugar. Measure blood sugar regularly. Monitor your blood sugar regularly. Recommended by your doctor and adjust your diet and medication in a timely manner. Medication management. Take your medication on time. Following your doctor's action and take one eclamptic drugs or insulin regularly. And understand the effect of the sugar. Know the effect of the sugar and possible side effects and communicate with the doctor in time. Moderate exercise. Exercise consistently. Choose exercise that works for you, such as walking, swimming, or yoga, and get at least 150 minutes of moderate intensity exercise per week. Mental health. Stay positive. Diabetes management can be stressful. Seek psychological support and counseling. Regular eyes, food, kidney affection, and cardiovascular checkups are performed to detect and manage complications early. Health education. Learn about diabetes, understanding the performance management methods, and self monitoring scaling of diabetes. So Maoyin, after talking so much about diabetes, have you learned anything?
Finally, I would like to say that diabetes is a preventable and controllable as long as we pay attention to it and strictly take the preventive measure, we can reduce a risk of the diabetes. For the parent with diabetes, treatment and management must be carried out steadily in accordance with the doctor requirement to control the blood sugar and reduce the occurrence of the complication.
All right. I believe you have learned a lot about diabetes in this symposium. Thank you for your listening. Okay, this is our reference. Thank you.